What's up, guys and girls? Welcome back to another kinesiology taping video. I am Chris Kalis, also known as the Mobility Project. Before we get into this video, please don't forget to subscribe, leave a like if the videos are helping you, and hit that notification bell to stay up to date with all of these new videos I will be posting. So we're going to look at a very simple technique to just create support of the AC joint and alleviate some tension that might be feeling with a downward pull or a separation coming from this joint. So Ashley is going to actually help with this technique. We've got 3 pre-cut strips. And so what we're going to do is we want to help bring this into a more elevated state and keep this held up, because if there's pain on this downward pull, then we want to help anchor it into a more compressed or stable state. So we're going to tape from high to low. And again, the taping direction is based on how you want that pull to occur. So she's actually going to take her shoulder into a slight elevation to start. I'm going to anchor that tape, and we're going to go over the delt, the medial delt head. So I'm going to anchor that tape. It's not all the way up the trap. And what I'm going to have her do is, once it's anchored there, she's going to use her hand to just hold and glide her tissue up. That's what feels good for her. So we're going to set that tissue in that held upward position. We have about a 50% stretch. If you need more, you can go 75, 100%. And then we run that right over the side delt. And we're going to do 2 strips like that. I'm going to have her pull her shoulder back slightly this time. We're going to anchor that first, basically right at that AC joint, a little bit further up the clavicle, but pretty close, not all the way up the trap. She's going to hold that tissue, glide it up where she wants it. We're going to lay that tape down, and again, right over that medial delt to create that support. So if she just turns to the side, we just have a double eye strip right over that delt. All right, and the last little piece, we're going to just go around the anterior and the posterior delt heads. And so this one we've got is an eye strip, but I've cut it, okay, up the center in a vertical fashion. We're going to do the same thing. I'm going to anchor it right over the middle of those orange pieces. And I'm just going to take 1 strip, and I just want her to bring her shoulder back, little internal rotation. We're going to run this around that front. And now she's going to bring that across. Good. Now we're just going to run this around that back. So it looks like a wishbone. All right, it looks like a wishbone, but we have a nice support system for this medial delt. The tissue is set into the current set position of having it being lifted towards the AC joint rather than being pulled away. And we just kind of help set that fascia into that new state. So that's a quick, easy one for stability of the shoulder, AC joint, if it feels like it needs to be brought back up towards the joint versus being stretched or tractioned away from the joint. Thanks for watching, guys. Stay tuned and check out the other K-Tape videos I have. As always, we are using the K-Tape brand Tape Geeks. Their link is in my description of this video and every other video. Check out the link, save 20% on your K-Taping orders, and I'll see you in another video.